CBT is a type of treatment that most people have heard of, and it tends to be the thing that most GPs and consultants will automatically jump to as the first line of treatment. Now, there's a lot of great things about CBT. It is a way of thinking about your thoughts, your emotions, and your behavior, and almost in a triangle sense, how each one impacts the other. And so what's really nice about CBT is by identifying how each thought pattern or each emotion will impact behaviors and the thoughts of the other in a way that might be helpful but might be not in line with the goals. We can start to make changes on any one of those that will end up impacting the others. Now, this might be challenging the thoughts by seeing how many errors in thinking, and there's a whole list of different types of thought errors that are out there, such as overgeneralizing or personalizing things, having all or nothing or black or white thinking. These are some of the thought errors that are very common amongst the general population. And once you start to notice how often you can think along these errorful ways, you can see how that impacts your emotions, your behaviors, and how even if you have an emotion, you end up doing certain thoughts, errors that again impact behavior in ways that are not what you're looking for. So what we're looking to do with cognitive behavior therapy is identify if there are thought errors, and there are many that are out there that the general public use, whether that be all or nothing thinking, overgeneralizing, personalizing. It's the way that the mind is processing what's happening around it. And that can happen in a way that affects our emotions or affects the way that we behave when it's based on errors in the way we're processing the environment. So identifying some of those and challenging our thought content can have big impact on the emotions we're having or how we then behave in the world around us. It can be very helpful for influencing symptoms such as motivation issues or self-esteem and self-worth and value. So CBT has a big place within therapy. The thing about it, though, is that there's many other types of treatment that are available also. And those CBT might be the one that's most well known, and many people come to us saying, is CBT something that we can do? We also have a lot of people who come having already tried CBT and feeling that it hasn't worked for them or hasn't been successful. We like to go back and revisit that, but we use some of the other techniques available to set up making CBT more effective. Or we completely go down another line depending on what the person is looking for.